And again, there are people out there that have this view of your spine can lead to all these problems, but the downside is that it takes effort. It takes effort and time on not only your part, the clinician, but the patient's part. And so 5-6 weeks of putting in pretty solid effort, day in, day out, not at the clinic, but throughout your daily life, versus popping a pill and waiting and seeing. And one of them is a lot easier, and one of them is a lot more lucrative.
Are there people that this treatment wouldn't work for?
I've had a few people that after evaluation, I said that this treatment probably wasn't right for them. One person specifically comes to mind. He was an older gentleman, maybe in his mid-60s. He had had multiple surgeries, and I mean, somewhere around 10 surgeries for his condition throughout his lifetime. He was on multiple medications and about to start a new medication, peptide therapy, and he was also morbidly obese. And my treatment relies on minimizing your variables and doing a lot of work to your body. And he had been this way for so long. Because of his weight, it would be hard for him to move. Because of his reliance on medication, and because starting a new medication, I didn't think that he was right for this treatment. So I'm sure there are people out there that that just don't really necessarily fit. But for the most part, most of the people that I've evaluated have had a pretty similar presentation, pretty similar areas of their spine that are stiffer and tender, pretty similar limitations in ability to squat, bend over. They have some form of hip, thigh, knee, foot and ankle issue as well, some history of low back pain, and those symptoms are some of the first to respond, which typically tells me I'm on the right track.
What is your hope for Crohn's treatment in the future?
I hope to change the face of a lot of treatment for GI issues, and let's say specifically Crohn's. I hope that in the future, when you go to your doctor and you say you have abdominal pain, bloating, nausea, diarrhea, constipation, that after they've done their blood testing, after they've done their imaging, and they haven't found the quintessential telltale findings, if it's not just quite fitting, I hope that the next thing they're going to say is, let's get your spine properly evaluated, or even if they do find these, let's get your spine properly evaluated before starting lifelong, life-altering medication that just manages your symptoms.